I had the vertical sleeve gastrectomy. At the time, I was gaining weight. I had my last child in '97, and my weight started creeping up around the time she was about 5 or 6. One of my parents had passed away, and food just became a comfort. And before I knew it, I had gone from, a normal weight range, and I had gained about 100 pounds. I got the sleeve, and I was able to lose 100 pounds, and I have maintained my weight loss since that time. I had issues with things that were acidic, things like fruits, like oranges. Sometimes things like tomato-based products would give me neheartburn, pizza. And one thing I had to be very careful of was making sure I didn't eat too close to going to bed. And every so often I would eat something too close to laying down. And that evening, as I was trying to sleep, I would feel like I was choking.
Trudy was a great candidate to have a LINX implanted because of her great success from bariatric surgery. She had lost a significant amount of weight and almost normalized her body mass index. However, she was still suffering from this erosive damage in her esophagus. And so, because of her great weight loss and having a body mass index well under 35, she well qualified to have a LINX device.
I was on a proton pump inhibitor for acid reflux, and that helped maintain the symptoms, but I also had silent reflux. So it meant that the reflux was there, but I didn't always feel heartburn. I didn't always feel symptoms. So I would go in for regular testing every year, and the doctor, they would go in and they would look at my esophagus, and they were starting to see damage from acid. So that's what led me to investigate what my options were at that time.
Many people are tired of taking medications for their heartburn, and many don't achieve symptom control even on their medications. That's what leads most people to seek out a consultation with me to talk about hiatal hernia repair and LINX surgery. LINX surgery is an attractive option for patients after sleeve gastrectomy suffering from reflux because they're not candidates for a fundoplication. That part of the stomach has been removed during their sleeve gastrectomy surgery. For these patients, hiatal hernia repair and LINX implantation offers them a reflux control option that does not require any of their native tissue.
I have not had any difficulties with the device. The only thing I just have to remain mindful of is just making sure that I'm not eating too fast, not eating too much. Make sure that you go back to chewing your food thoroughly, eating slowly, and just taking your time with the eating process, because you have to get used to the device, how the device opens and closes, and you just have to make sure that you're not overeating in the very beginning. So that was a little bit of a learning curve.
Well, my bariatric patients are very familiar with changing what they eat and how they eat as preparation and recovery for bariatric surgery. So the transition to doing frequent small meals after a LINX implantation is a pretty natural progression for them. Patients seek me out looking for improvement in their reflux symptoms. My goal is to eliminate their symptoms altogether, hopefully without the use of medications. Patients certainly expect improvement in their GERD symptoms, and I try to coach them along those lines to have realistic expectations that they're going to be significantly improved.
I could tell that I wasn't waking up and coughing almost instantly. And I was like, this is doing something. Something's going well. And they told me I could stop taking the antacid medication as well. I did not have issues with that anymore. I didn't have issues with any acidic foods, any of the citrus fruits, and any of the tomato-based products that I used to have issues with before. I didn't have issues with those foods anymore. I always recommend to my friends that are having, issues with acid reflux, I tell them there's alternatives out there, but make sure you talk to your doctor about them. And if they offer the LINX, look into it.